And a very good Sunday evening to you from NBC News World Headquarters in New York City. I'm Richard Louie. Thanks for being with us. Dual crises tonight that are plaguing the president. NBC News confirming a story first reported in the New York Times about Russia offering bounties to the Taliban to kill U.S. troops in Afghanistan. The president tweeted before golfing that he knew nothing about that and that everybody is denying it. John Bolton, Trump's former national security advisor, did react, though, calling for an immediate investigation.
Active Russian aggression like that against the American service members is a very, very serious matter, and nothing's been done about it, if it's true, for these past 4 or 5 months. So it may look like he was negligent.
At the same time, coronavirus cases continue to spike, forcing certain states to pause or even roll back reopening. California, like Texas, now closing bars in several counties as cases refuse to slow. More than 126,000 have now died, with more than 2.5 million cases in the United States. The vice president was in Texas this afternoon, and he seemed to reverse his reluctance to suggest to wear masks.
The president tapped me to lead the White House Coronavirus Task Force, and part of our guidelines to open up America again, encourage people to wear facial coverings where social distancing was not possible. So our administration is promoting the practice on behalf of the administration, the White House Coronavirus Task Force, and the president will continue to do that.
Also breaking tonight, Mississippi joins the rest of the union by removing the rebel battle symbol from its own flag. State lawmakers voted overwhelmingly to remove the image, which is home to the highest percentage of African Americans in the entire country. Joining us now to discuss, Annie Carney, New York Times White House correspondent, Lanhee Chen, Stanford University Director of Domestic Policy, Michael Starr Hopkins, a Democratic strategist and the founder of Northern Star Strategies, Dr. Lipi Roy, NBC News Medical Contributor. Doctor, we'll start with you first. Yesterday, depending which numbers you looked at, well, it really didn't matter. There were several states that had hit brand new single-day records. We're seeing the United States overall hitting new single-day records. What are you looking at right now?
Good evening, Richard. It's good to be with you. What I'm seeing is just a catastrophe. It's a catastrophe. Nothing is getting better. Certain states are getting better. As you know, here in New York, after we went through a hellish period, our local leadership, our mayor, our governor, did the right things. They listened to their health advisors and they followed the data. They shut things down, stay at home. At the time, we didn't even have masks universally available, that we had to preserve it. But now we have masks showing that it actually can protect or reduce the transmission of the virus. We know that physical distancing, these public health measures work, Richard, but we're not seeing states widespread implement these measures.
Annie, the White House, the task force, in their last briefing, are we hearing pieces of information that are satisfying the questions that are still out there? What are you going to do?
I mean, the administration has continued to try and project confidence and try and project the fact that the worst of the virus is behind us. We're reopening. We saw that, it feels like a million years ago, but just last weekend in Tulsa, where the president staged a comeback rally. They are very eager to move on with the narrative, even though this is clearly not behind us. And Republican governors, like in Texas, are kind of turning back some of the reopening that had been begun. A thing to keep an eye on now is, will the president's rally schedule continue? He was supposed to have a rally in a few weeks in Alabama at a massive stadium. Will that still go on? The vice president pulled down some campaign-related travel this week. We will have to see if they learned a lesson from Tulsa, if they've learned a lesson from watching where the public sentiment is and where these cases are in states across the country, or whether they keep going with a narrative that doesn't match the reality on the ground.
Oh, the narrative so important here. This, as we were just starting this hour with the vice president seemingly reversing his reluctance in discussing masks as an important part of staving off an increase in the virus itself. Lanhee, when you look at what the vice president has done, when you look at what Mitch McConnell, the majority leader out of the Senate, also holding up a mask, are we starting to see some cracks in the support of this president in the inconsistencies we've just seen within the last 24, 48 hours?
Well, Richard, I think you're seeing Republicans send, in this case, the right message by wearing masks, by demonstrating that it is an important part of the continuing strategy to defeat this coronavirus. I think it would mean a lot if the president wore a mask. I think it would send a very strong signal if he were to do so. But so far, all we've seen is that the mask wearing has been limited to the vice president. It's been limited to Republican senators, to members of the administration, including the Secretary of Health and Human Services. But the president himself has not donned a mask, at least publicly, or at least for consumption by the American people. And I think that would be a very important marker, a very important change, because at the end of the day, there's only so much signaling other Republicans can do. A lot of folks out there will take their signals only from the president, and so it's going to matter whether he has a mask on or not.
Talk about signaling. Let's listen to what the vice president said earlier today in Texas.
There was guidance throughout that applied to all of the phases. And chief among them was that people should continue to practice good hygiene, wash your hands, avoid touching your face, and wear a mask. Everyone to wear a mask in the affected areas. And wearing a mask is just a good idea.
Michael, your thought?
I mean, the VP can pretend like they've been saying wear a mask the whole time, but this sense of toxic masculinity, this idea that wearing a mask is somehow making you weaker, making you less of a man, is what has contributed to what we're seeing across southern states. This idea that we're not all wearing masks to protect each other. And so now the lambs are being led to the slaughter, and it's disgusting and sad, to be honest about it, because states like Texas, states like Florida are now going to see what we dealt with in New York and all over the upper Northeast. It's unnecessary. The president said 65,000 deaths was going to be the ceiling. Well, now we're almost at 130. I can only imagine what we're going to be at come September 1st.
Is it too late, Dr. Roy, even if all of these states that are now the new epicenters of America, if they were to implement wide use of PPE?
Richard, they need to implement it now. They need to implement this 2 months ago.
Yeah. So is it too late?
It's never too late. They need to do it. It can't be words. You talk about narrative and language. Words like, oh, we encourage, we recommend. No, they need to do this. Just like I can't just drive 100 miles an hour down any street, right? I'm not encouraged to wear a seatbelt. These are required by law. We need to do these public health measures to save lives, and that needs to happen now.
Annie, what are we seeing with the vice president here discussing the issue of use of masks, and just within the last 24 hours not hearing the same thing from the vice president? Will we see the president all of a sudden potentially allow the discussion of using masks? Is that even possible?
The president just last week, I think, gave an interview with the Wall Street Journal where he said that he viewed mask wearing not so much as a practice that protected someone's own health, but as a political statement, an anti-Trump political statement. That's where he is. It is true that mask wearing has become a politicized issue in this country, but the president has stated on the record that he sees it as an anti-Trump statement to wear a mask. We saw supporters of his coming into Tulsa, into that indoor rally last weekend, and showily discarding the masks that were given out to them there as a we're here to support Trump, we're not going to wear this. So if we see a big change in tone from the president, it will be a 180 shift from where he is right now.
And one of those drivers here that everybody understands in this discussion here is the economy. He's watching it very closely. That could be potentially a push to change his tone. Lanhi, as I look at the market futures, they're down at the moment. It was not a good week last week when we look at the markets. This president watches the markets, decides many a time on how he will move and make his decisions based on that. Do you think that might push him to change his tone on something as simple as masks here?
Well, just going to the macro level here for a second, Richard, I think that the president this weekend has been subject to warnings from Republicans across the board that he is in danger of losing this election. And that will be a function of the public's view of his response on coronavirus. It will be a function of the economy. As you know, some of these things are in his control. Some of these things are not. So my guess is the president will be watching the economy very carefully. Whether it will change his behavior on masks, I'm dubious of. I do think it will determine how much he's focusing message-wise on the state of the economy. We've got jobs numbers coming this Friday. The June jobs numbers will be out this Friday. We've got continual data coming in based on what's happening in the stock market. So we'll have to see. But clearly, the president, if his focus is on re-election, this is a week when he's going to have to change course if something is going to change with respect to the arc of his campaign and the likelihood he gets re-elected.
One of the arcs that may not be able to change, HHS Secretary Alex Azar commented on earlier today. Take a listen.
The window is closing. We have to act, and people as individuals have to act responsibly. We need to social distance. We need to wear our face coverings if we're in settings where we can't social distance, particularly in these hot zones.
So the secretary here, Michael, is saying it may be too late to reverse this, or the window is closing. I should be more specific here. Is the window also closing potentially on this president as the polling, at least, in the states that are also seeing high increases in COVID cases are going down in terms of support of this president?
Yeah, I mean, if you look at Florida, for example, Florida is a state where the president should be having huge gains in terms of 65 and up. Well, instead, he's seeing his support plummet because people who are older are not only now losing their health insurance, but they're seeing the president push forth policies that are going to directly affect them. You know, the villages has kind of been the place we've been talking about today because of the video that the president retweeted about white supremacists. Well, in the villages, that's primarily Republican voters. Those people are extremely vulnerable to coronavirus. By telling people not to wear masks, by politicizing that, he's killing his own supporters. It's why we're seeing in Florida him be down by almost double digits. In states like Texas, it's almost tied. In states like Georgia, Joe Biden is up by 1. He is going to lose not only suburban women, but if he's not careful, he's going to lose white people who are over the age of 65. And that's something that I don't think's been done since Nixon.
When we're looking at the numbers to try to understand what this administration as well as state leadership might employ going forward, California, for instance, reversing its opening procedure, now asking for some bars to close down. Dr. Roy, when might we see the death toll tick up right now? So far, at least looking at the 14 trailing averages, the 7-day trailing averages, good thing, it's staying low. But based on these new cases, might we see that death rate go up?
Yeah, that's a great question, Richard. And think back to what Dr. Fauci said at the White House coronavirus briefing. You know, the deaths are a late indicator. They lag, right? Just like even the cases lag. So we're seeing a rise in cases. We're going to see a rise in deaths, which is just harrowing to think of, right? We're already at 126,000. It's just going to go up unless every state really just hunkers down and practices these really important public preventive health measures.
And we're hoping for those numbers to go down. Certainly, we will see this coming week. Thank you so much, Andy Carney, Lan-Hee Chen, Michael Starr-Hopkins, Dr. Lipi Roy, our contributor here at NBC News and MSNBC. Thank you all. Up next, Congressman Ami Bera joins me to talk about California, that point we were just discussing, the measures that they're now undertaking to try to stop the new spike in cases in the state, as well as why he's supporting a sweeping police reform package.